renal colic. Let's say we have we have renal colic or have a biliary colic. A biliary colic, this is where we have a stone somewhere in the biliary tract, specifically within the cystic duct. There is a stone within the cystic duct, and the bladder is contracting. Let me say, yes, yeah, it's contracting against that cyst. You have a cyst, you have a stone within the cystic duct, and there is a contraction against that stone, and then at the end of the day, that induce a severe pain, a severe right upper quadrant pain within the patient. So we can do, for the purpose of that, we can do CT scans.
Okay.
Yes.
That is
we can also do CT.
accurate.
Yeah, that's
specific and sensitive.
Yeah. Yes. That's the most accurate. And we can also do CT scans when we are suspecting some stone within the urinary system.
Wow.
Urinary tract.
Wow, that is brilliant. Right, Doc, thanks for that. We like that, and I believe we are all learning and we are sharing information and we are learning something purposely for our license exams and then medical school exams and other things. So, as Doc has already given us, he was saying that in terms of abdominal pain, depending on our suspicion and other things, we can order for imaging like radiographs, like plain abdominal radiograph, when we think the cause could be intestinal obstruction. Doc was also saying that we can use CT scans when we have like stones in a kidney and maybe gallbladder, something like that. We can prepare a CT scan over other tests or other imaging. And then Doc was also saying that when it comes to ultrasonography, ultrasound, when the patient is, let's say, having appendicitis or pancreatitis, inflammatory diseases, we can also prefer, ultrasound or recommend ultrasound. And when the patient is a woman or a lady in a childbearing state, we can also think of maybe ectopic pregnancy, and then we can also think of ovarian cyst and ovarian teratoma. So we can go for ultrasonography. And then Doc has been giving us different ideas on these imaging and other things. And I believe you out there can also figure out and come up with what you think could be an answer to this question, or maybe what is your opinion on that. And I believe your opinion and your suggestions are respected and they are all welcome. Thank you very much, Doc. Thank you very much. And now, I would like us to learn some pharmacology here. Because when such patients comes and then you diagnose them, some of them require interventions like surgical intervention, and some of them also require pharmacology. It means you have to give them drug to cure the disease. For instance, somebody with peptic ulcer, and if the peptic ulcer disease is being caused by H. pylori, we prefer giving them drugs like triple therapy. So, for instance, I will give amoxicillin, I will give clarithromycin, and then probably I'll give PPI like lansoprazole or omeprazole. And then other people will even add metronidazole to it to make it 4. And then here in China, we use 3 drugs to kill the H. pylori, right? But in the case of appendicitis, we will prefer doing surgical intervention by doing appendectomy, like we have to remove the appendix, right, to stop the pain and other things. So now, not talking about the surgical interventions, I would like us to talk about the medical interventions, like giving them drugs and then healing their pains, or relieving their pains, or stopping or reducing their pain. So I want us to talk about this if there is time. But before we start, do you have any idea about analgesics? When you say analgesics, do you have any idea about that?
Yeah, analgesics are medications that are used to relieve or reduce pain.
Wow, that's good.
Yes.
That is so simple and easy to understand, right? Right.
Sure. Yeah.
So, with that, I think every country has a guideline that they use in their medical sector or in their hospitals. So, every country like China has a guideline that they follow. If you go to UK, they have a guideline they follow. If you go to US, they have a guideline that they follow. But looking at the whole world, we are being, governed by WHO, which means the World Health Organization. So when the WHO gives a recommendation on
Yes.
treatment of certain disease, most of the countries have to adjust to it and then go by it. So do you have any idea about the WHO analgesic ladder? I remember I read a literature where they had that kind of discussion in that. So I don't know if you have an idea about the WHO analytic ladder, the ladder of the drugs or the steps in which you should go to give the analgesics or the painkiller. If you don't have, maybe I can help you to also elaborate on that. But I think you may have an idea on that.
Yeah. For I have an idea. I have an idea of the WHO energy ladder, but I think I can share my screen to be able to explain that.
Okay, you can share your screen. All right. Right, then that is okay. I think you can go by that. All right.
Yeah.
Okay. Okay, Doc.
So just a moment.
All right.
All right. I think it's okay.
All right.
It's okay. Okay. So we have the WHO energy ladder.
Okay.
We have three steps.
Mm.
And first steps, we can give non-opioids
Okay.
plus all manners adjoints.
Okay.
For the non-opioids, we have drugs like paracetamol or NSAIDs. We For step two, we can give drugs like opioids for mild to moderate pain. That is when there is a mild to moderate pains, we can give opioids plus or minus non-opioids, or we can also decide to add an adjunct or not. So um, we have an example of opioids. Yeah, we have the codeines, or we can give tramadol, and we can either decide to add paracetamol as a non-opioid, or a diazepam to that as well. We On the other hand, we can use codeine with paracetamol or ibuprofen. All right. So all of these combination of drugs is actually done when there is a need to do them. And step three, we can give opioids for moderate to severe pains. That is when there is when the patient has a moderate to severe kind of pain. We can give opioids plus or minus a non-opioid drugs, the paracetamol for an example, and then the plus or minus an adjuvant. I'm sorry, plus or minus an adjuvant. And an example of opioid that can be given in this case, we have on our screen, we have oxycodone or morphine, or we can add we can have a phenyl citrate. Yeah, that is a phenyl citrate.
Yeah.
And so these combinations of drugs are given when necessary, when it is necessary. Like we can do this combination when there is a need, when it is necessary.
Okay.
So let's take for an example. Here a patient having a kind of severe pain, right? A patient having a severe pain that is in the acute state. We can start from step 3 immediately. Yeah, because the pain that the patient may be feeling, it does not call for starting from step 1 or maybe going down a ladder from step 1, step 2. So we can just start from step 3 because of the severities of the pain.
Wow.
So yes, and then we can work down to step 1 in the chronic pain, and then the analgesic attack should be given regularly to prevent a breakthrough pain. So this is the WHO ladder.
Okay.
And we say we have 3 steps. So for each steps, there are combination of drugs that you have to give to the patient based on the severity of the pain.
Okay.
And those combinations are not necessary, like it's not compulsory, it's not obligatory that you should give them, you should give those drugs, but there are conditions that call for those combinations. If necessary, you have to do it.
You have to do
You
it.
do them.
Wow.
Yes. So as we say here in the acute state, we have to start right away from step 3. Give morphine. Yeah, we can give morphine in this case, and we can decide whether to add some non-opioid like paracetamol to make that combinations.
Perfect. Wow.
So that's just my own understanding about the WHO energies a lot. I think that if you can add on something, or if there is anything you can add on.
Oh, okay. Okay. Thank you. I think, Doc, that is all that you've said. I think it is quite clear, and the people out there can understand clearly.